She's a good friend. Please welcome Rachael Ali-Permell.
Oh, thank you guys. Okay. So moving right along, everyone can hear me, right? Way up here? Whoa. Okay. Alrighty. So thank you, Al, for that introduction. Our next lecture is going to be on smoking cessation. And with this topic, I'm just going to focus on the hazards of cigarettes. And then my next lecture is going to be about all the other ones, e-cigarettes, hookah, marijuana. So just keep that in mind that I'm not going to touch on the e-cigarettes in this lecture. Okay, so the learning objectives for this are, we're going to learn the effects of smoking and why it's so dangerous, and how quitting can affect our PFT results no matter when. It's never too late to quit because it can definitely help rebuild the lung and you get better PFTs after you've quit. So it's never too late. What makes tobacco addictive, the smoking cessation medication and therapies that are available, and then the strategies to quit smoking and supporting someone when they decide to quit. So those are things that we're going to cover in this lecture. So what is the problem? We know that smoking is the #1 cause of death. And smoking is related to many of the diseases that are, the chronic diseases that are, that we have when someone is a smoker or actually exposed to smoking. So we have, smoking rate is 2 to 3 times higher among those living with mental illness because what is one of the reasons why people do start to smoke? It's because it helps them relieve their stress and forget things, and the nicotine in it actually causes them to relax. So it is a stress relieving mechanism. People who live with mental illness die an average of about 25 years earlier than their peers because of all the predisposed illnesses that come along with that, where I'm going to go into it, where the medication for mental illness is affected by smoking and nicotine and tobacco, actually. Okay, so here on the list we have all the different chronic diseases that may occur due to someone who has smoked long-term, and the cancers also. Okay, lung and neck, head and neck, it affects that. Lungs, leukemia, the stomach, it affects all different aspects of our body and our organs. Okay. So, about 443,000 U.S. deaths attributed each year to cigarette smoking due to those secondary disease states that I mentioned before. Lung cancer, ischemic heart disease, chronic obstructive pulmonary disease, which is very near and dear to our hearts because we see a lot of those patients. A lot of other cancers, stroke also is a contributor, and other diagnoses contribute to that. But if you look at lung cancer, that's pretty high up on the scale there. So why is smoking so dangerous? Because of all the different chemicals that are in it. Does everyone here have an idea of all the different chemicals that are in a cigarette? You know, when you think about it, that would scare the heck out of me. I would not want to smoke. You know, you have ammonia, you have formaldehyde that they embalm the bodies with. So could you imagine what it's actually doing when you inhale that into the lungs? Cadmium, from batteries. You have stearic acid that is found in candle wax. Carbon monoxide, of course. Rocket fuel, right? Methanol, methane, acetic acid. All these different things make up the component that's in a cigarette. You have tar, you have the addictive factors such as the nicotine itself, and then there's flavorings that you really don't know exactly what they put in those flavorings, and CO2, obviously. So those are the dangerous components of cigarettes. And these are pictures to show you how cigarettes actually affect our body, right? You can really tell the difference between someone who smokes and someone who doesn't smoke. You can tell how they become wrinkled at early age, their lips become very dark, have that kind of cough, that's a chronic cough. Their fingernails, the beds of their fingernails get, darker. So all these things. Pretty much you wouldn't want your body to get like that after years and years of smoking. So how many people have seen this ad on TV? The one with the break, right? It's amazing when, I'll tell this story because I remember it, and I feel like I'll always remember it. When I worked in Syracuse, upstate New York, before I came to North Shore, I remember seeing this guy that outside of the hospital. He was actually an inpatient, but they would allow him to go outside. So he goes outside and he smokes through his trachea, and I'm like, oh my God, didn't he learn his lesson? Why would you do that? But this is the thing, because cigarettes are so addictive, when you have to have it, you have to have it. And some people it's just very difficult for them to get to the point where they feel that, okay, maybe he feels his life is almost to the end, he might as well enjoy the rest of it. So that's how, unfortunately, that's how some people do feel. And all cigarette packaging have that warning on there, so they are letting people know that it is very dangerous. But still people continue to utilize it, to use it. And although it's very, very expensive, but every year the prices of cigarettes are going up, people still find the money to buy it. So how does it affect our lungs? So here we don't have a pointer, right? Okay. So anyway, here up to the right-hand corner, your left, we have healthy lungs. The alveoli look very healthy, nice and pink, nice and open. Once we start as a smoker, the harmful particles start trapping into the alveoli, and then it causes an inflammatory response. Once that inflammatory response happens, then it causes the septums between the alveoli to start deteriorating. And what that does, it dissolves it, and it creates a huge, large cavity of deposits of the carbon monoxides and all the different tars and stuff that goes into the lungs, and that is what causes the emphysema disease at the end. So this is how it all pans out. So why is tobacco so addictive? We have three different responses. So you have a physical addiction, you have a behavioral addiction, and an emotional addiction. So with the physical addiction, it's a nicotine that changes the brain chemistry. So we are, our brain is made up of a dopamine pathway. And what that does, it's like a happy, pleasurable transmission that goes on when you smoke, right? Or when you get something that's satisfying to you. The dopamine reward pathway. So as your body, you start smoking, you get that pleasure, you get that satisfaction, you get decreased stress. What happens is the body remembers, because the brain is a memory for memory and behavior, right? So there's transmitters in there that remembers that when I smoke cigarette, or when I do whatever, when I eat cheeseburgers, or when I have candy, I feel really good about it. It makes me feel nice. It makes me feel good. So your body is going to remember that and want to continue to get more and more of it, right? So that is how the physical addiction occurs. With the behavioral addiction, situations that are linked with tobacco use. So for example, You wake up in the morning. This is how smokers usually, they have a routine down to the T. So the behavioral, you wake up in the morning, you have your cup of coffee, and with that cup of coffee comes a cigarette. So that is where it becomes a behavioral response, where you are, with the coffee is a cigarette. Or while I'm driving to work, I need to have a cigarette, because that is how your body has created its routine, right? And when you get thrown off of that routine, how do they feel? They get headaches, you get antsy, you get irritated. So that is the behavioral response. Then an emotional addiction becomes primarily, it's a coping mechanism. So again, someone pisses you off, you want to go out and have a cigarette to calm yourself down, right? So that is where the emotional part occurs. You know, you feel down, you feel stressed, you're going to have that. So those are the three emotional components to addiction. You have your emotional, your physical, and your behavioral addiction. Components, actually. Okay. So symptoms of addiction. Remember I talked about the irritability, where they become irritable, anxious, headaches. These are signs of when someone needs that. You need that nicotine, you need the tobacco hit, right? And that comes along with drugs also, but we're sticking to cigarettes for now. So these are the different things that attribute to the addiction. These are the signs and symptoms. So smoking cessation can improve lung function, as I spoke about before. There was research done by a university on smokers with asthma shows that smoking cessation can improve lung function testing by 15% in about 8 weeks. So after 8 weeks, after quitting smoking, about 8 weeks later, your lung function tends to improve, which is that's good, because a lot of people would say, I've been smoking for so many years, and, you know, like quitting smoking is not going to make a difference now, but it really does. It really does. The statistics have shown that it does, and there's a lot of research out there to prove it. The American Lung Association states that once you have stopped smoking, the lung capacity should improve on its own by 30%. Less than 12 to 14 weeks. So that's significant. You know, lung function is important, because those are the people that is what helps you go along your daily activities. If in fact, I mean, you see smokers every day in the hospital that they require oxygen. They can't walk very far without getting short of breath. So your breathing is like the most important thing, basically. Without that, you can't function and do your activities of daily living on a normal basis. Shortness of breath will decrease in about 1 to 9 months. So as the lung function improves, shortness of breath tends to deteriorate, and you start to live normal, start to do things without getting short of breath. Climb steps, walk far distances, you know, things like that. So lifestyle changes, regular exercise, healthy diet, continuing abstinence from smoking all helps to improve lung functions. So here we have a graph that was done by the Mayo Foundation for Medical Education and Research, where it shows that for a smoker, if you do quit, oops, how did that happen? Okay, if you do quit, what is going on here? I shouldn't have touched the screen, because I touched it and that's when it went haywire. Okay, so as a non-smoker, you tend to maintain a normal range for your lung function, because technically you haven't done anything to affect your lungs, right? You haven't smoked, so it tends to stay at a pretty normal range. As a smoker, if you quit in time, that shows that your lung function will improve, okay? If you quit smoking, see the dotted line across? It shows that you're still able to maintain a normal lung function, and and you may have limited, depending on how old you are, you may have limited exercise abilities. But if you're a smoker, you continue to smoke, I don't want to get into courts here, the line comes down and pretty much you have a short life because your lung functions are going to deteriorate pretty quickly, right? So this is kind of proof that this definitely, quitting smoking is very, very, it's something that is worth doing. Okay, so how does it, when you quit, how does it affect the different parts of your body? All right, so 20 minutes after you quit, people, you know, this is kind of weird, but take it for what it's worth. The blood pressure drops to normal, okay? The pulse rate drops to normal. The temperature in your hands and feet increase to normal. 8 hours later, carbon monoxide level in blood drops to about normal. It depends on how long you're a smoker, because sometimes that level still stays higher. The nerve endings, about 48 hours later, nerve endings start to regrow. Ability to smell and taste is enhanced at that point. 2 to 12 weeks, the circulation improves, your breathing improves, right? Walking becomes easier. So all these things, nicotine and tobacco really does affect your body in every aspect, as we've seen, right? 1 to 9 months, the coughing and sinus congestion decreases, right? Shortness of breath decreases, all over energy increases. 1 year later, your excess risk of coronary heart disease is half that of a smoker. Okay, so 1 year after you quit smoking, even your heart or your ability to maintain a so-called normal heart or to prevent from getting a coronary artery disease is definitely decreased. In 5 years, stroke risk reduced to that of a non-smoker, right? And then risk of cancer in the mouth, throat, and esophagus is half that of a smoker. So it is definitely, all these aspects are good things. 10 years later, your life expectancy is comparable to a non-smoker, right? So anyone that smokes, we as respiratory therapists should be showing them things like this or telling them things like this, because we're the ones that when they come in with the COPD exacerbation and they're smoking, we really have to push smoking cessation programs on them. Okay, that's our job. How many of you guys have smoking cessation programs in your facility now? Not very many? Wow, because that's where the future is going, to educating our patients on things like this. Smoking cessation programs, RT navigators, where we have specific therapists that are kind of their duties are to go out and educate patients on COPD and smoking cessation and pulmonary rehab. All these things are very, very important, and that's where the future lies for respiratory therapists. We're not going to be in the hospital very much longer we still do vent care, but all that other part where we're just giving treatments, that is no longer going to be the case. We're going to be out there educating, doing post-discharge education on our patients and follow-up. And that is where a lot of insurance companies are heading. 15 years later, the risk of coronary heart disease are comparable to a non-smoker. So again, those are different facts that we can share with our patients. So smoking, how does it affect the respiratory system? We know that our respiratory system is lined with cilia. It is a thin-like structure that constantly moves to sweep toxins, mucus, and debris out of the lung. So what happens when we smoke and the toxins get into the lungs, it actually immobilizes those cilia and cause them to become deadened pretty much, and they're not going to do their job. So that's why you have smokers are constantly coughing, trying to get that mucus up. And a lot of times they end up with a lot of infections because they are not able to do that. Their cilia isn't working properly. So smoking, I talked about that just now. It takes a few months after smoking cessation for the cilia to regrow and continue to do their job. So eventually, when someone does stop smoking, the cilia does rebuild and start working again. So thank God that we were created that way, right? That our bodies can regenerate and start doing normal functions again. So how does smoking and mental illness relate? The higher rates of hospitalization for patients who are mental illness, who has mental illness and smoke. You know, I recently found this out, that cigarette companies target those facilities that are mental illness facilities. They actually give out free samples of cigarettes. That is actually a fact, because they want to obviously get these people addicted, and then they are going to buy the cigarettes. So giving out free samples are a way to get people hooked, and then, you know, that's a marketing deploy, how a lot of organizations and marketing products work. So, and with mental illness comes a lot of stress, a lot of depression, and people do look for ways to make themselves either forget it or be calm, because when you smoke cigarettes, you have a calming effect. You get that nice dopamine, relaxing reward that makes you feel good. So that's the whole idea. Okay, it's associated with suicide and psychosis. Interferes with full recovery, because when someone smokes cigarettes, it can interfere with a lot of their psychomedications, whereas they may require a lot higher dose in order for the medication to be absorbed. Because if they're smoking, the nicotine and the tobacco affects the absorption of their psychotic medications. So it barely works. They would have to increase their medication in order for it to work. And the more and more they smoke, the higher of a dose they will need of their psychological meds in order for it to work. So that's why many of them, you know, they're on their meds, but it's not working. Okay? So that's what I just talked about, where the antipsychotic, antidepressive medication doesn't work after a while. Okay, quitting is difficult, right? About 50 to 60% of initially successful quitters relapse within a year. Patients, sometimes we give up. We give up too soon. If we quit and you start having those symptoms, you tend to say, oh, forget it. I can't do this. You know, they have anxiety, difficult concentrating, increased appetite. You know, people always say, oh, I'm gonna quit smoking and I'm gonna gain weight, right? So that's one of their downside of quitting smoking, because they don't want to gain weight. But these are things that, as clinicians, you tell your patients, well, you need to use nicotine replacement therapy in order to make that quit a little bit easier on you, right? So you can't just say, oh, I'm just gonna quit, stop smoking, and that's what a lot of people try, and that's why it fails. So there's a lot of nicotine replacement therapies that are on the market now that they can utilize to help them quit smoking. The best option is the smoking cessation tool that the patient will use. There are a lot of different ones, and I'm going to go over that today, where there's a lot of options now. So quitting is not as hard as it used to be back in the days. Okay, so the FDA has approved these different therapies. The nicotine patch, nicotine gum, the lozenges, the oral inhaler, and the nasal spray. These are all, the ones on the left here are all over the counter. You don't need a prescription for them. The one on the right, those are the two that you need a prescription for, and those are medication, oral tablet. So the primary purpose of the smoking cessation medication is to reduce the nicotine withdrawal symptoms. Okay? It's not to say, you know, it doesn't have any nicotine in it. It does, but it kind of weans the patient off of the need for nicotine. Okay? So first we have the nicotine patch. The brand names are Nicoderm, QD, Habitrol. The patch strengths come in 21 milligrams, 14 milligrams, and 7 milligrams. As I said, it's like steroids, for example, where the doctor has to wean you off slowly, okay, by decreasing the dose as you go. And depending on how much cigarettes a smoker uses, that will depend on how much of a dose they start with first, right? And it's applied for 16 hours to 24 hours. And the next slide will kind of give you a better idea. So step one, if you have someone who smokes greater than 10 cigarettes a day, you start with 21 milligrams for that 1 to 6 week. Then you go to the 14 milligram, and then you go to the 3 milligram for the different, so the whole, it's a 10-week program, basically. And the person has to definitely follow this regimen. If you have a patient that smokes less than 10 cigarettes per day or weighs less than 45 kilos, then you would just start with the 14 milligram dosing. You don't start with the 21 milligram dosing. Okay, so that's how that works. So that is one. And again, when you introduce all these different nicotine replacement therapies to your patient, there's so many that they can, choose from, that you allow them to pick the ones that will be most appropriate for them, so you have a successful outcome. So with the patch, you apply upon waking up on a quit day. So you pick a date, stick to that date, write it on the calendar, and say, okay, on March 1st, I'm going to start quitting. That morning, they apply the patch. It should be applied on a relatively hairless location, such as the neck, the wrist, the upper arm. Rotate the application site to reduce skin irritation, because it can irritate the skin because, again, it has nicotine in it, right? You may get a little redness, swelling, rash, but the reaction is usually mild. You may use steroid cream to alleviate the reaction if there is any. With patients who experience vivid dreams, you remove the patch prior to bedtime, so you don't have to use it during the sleeping hours. I don't know, they're saying that is one of the side effects, and not everyone may have that. Do not cut the patch, because that is going to cause the nicotine to evaporate out of there, because it is a closed system. The nicotine stays in there and is absorbed through the patch into the skin. So you don't cut it thinking you're going to get half of the dose. Like sometimes we cut a pill thinking we're going to get half of the, right? So you can't cut it. Okay, the next thing that's available is the nicotine gum. And again, all these that I'm mentioning now is over the counter, so you don't need a doctor's prescription for it. Nicorette, Nicorelief, Thrive, I guess those are the different names for nicotine gum. It's available in 2 milligram and 5 milligram strengths. Okay, this is the part, and I want to ask this question. How many of you think it's like just chewing gum, a regular pack of gum? Okay, because that's what I thought too. It's like just chew it until the flavor goes and then you spit it out. No, in this case, this is how it works. So, I'll get to that point in a minute. If you have someone that smokes less than 25 cigarettes per day, you use the 2 milligram gum, because you need a lower dose nicotine. If they smoke greater than or equal to 25 cigarettes a day, you use the 4 milligram gum. Okay? Use 1 piece of gum for week 1 to 6, 1 to 2 hours. So every 1 to 2 hours, you're chewing the gum, and when you get that flavor, the flavor out of it, you park it on the side of your mouth, on either side. I didn't even know that, you see. So it's a good thing to have ideas, because patients may ask, how do I use this gum or whatever. So you do have to park it on the side so it gets absorbed. The nicotine gets absorbed into your system, right? So for the 12-week schedule, so week 7 to 9, you increase the number of hours that you're doing it. So 1 to 6, 1 to 2 hours. Every 1 to 2 hours you do it. Week 7 to 9, 2 to 4 hours. And then week 9 to 12, 4 to 8 hours. Right? So as you go, as the time goes by, you're doing less and less of it. So the maximum is equal to 24 pieces per day. So you should not exceed 24 pieces a day. Okay, so that's how it's done. You park it. The next time you do it, you park it on the other side. So this way you don't get irritation of your gums. But that is how it's done. Some side effects are indigestion, because sometimes when you swallow it, it irritates your stomach. Mouth soreness, that's why you would switch sides. Some people get hiccups. Jaw ache because you're chewing, quite often. Some dizziness, nausea, vomiting, weakness. So these are all side effects, not necessarily meaning that everyone will have those. Okay, so chewing gum slowly until a peppery or flavored taste emerges, then park between the cheek or the gum. Okay? Repeat the process for about 30 minutes until the taste disappears. So once the taste disappears, you throw it out. You follow the time period that you're supposed to, and then you put another one in. They say you should avoid acidic beverages 15 minutes before and during chewing, as they interfere with the nicotine absorption. So you'll have less absorption if you drink coffee, juices, soft drinks. So water would be the best thing to drink. Okay, then we have the lozenges. So with the lozenger, it's called Nicorette, Nicor Relief, available in 2 milligrams, 4 milligram strengths, very similar to the gum. But with this, obviously you're not chewing it, you're kind of letting it dissolve and deliver more rapidly than original lozengers. The Tic Tacs, it's like Tic Tac type lozengers. And with this, the first cigarette smoke within 30 minutes of waking up, use the 4 milligram lozenges. So you can still have the cigarette, because remember, we're just weaning at this point. You're not just stopping smoking and then, doing these things. You kind of, with this, you have your cigarette, use the 4 milligrams, because with that, you may not need to have another cigarette as soon as you normally have it, right? Because now your body has enough nicotine that it's satisfying your dopamine reward pathway, so you don't really need it. Your mind works, let me tell you, our minds are very strong, and it works magic. The first cigarette smoke greater than 30 minutes after waking up, use 2 milligrams. Okay, same for 12-week schedule for the nicotine gum. You use the 12 weeks. The maximum of 9 lozenges per day, so don't go over 9 per day, and maximum of 20 lozenges per day, or 5 lozenges every 6 hours. Okay, and these are the same type of side effects, because they're very similar to the gum. It's just different ways that you do it. Okay, allow the lozenge to slowly dissolve in the mouth. So remember, you're not chewing it like hard candy. You're letting it dissolve. Do not crush it. Do not chew. Don't swallow it. Same purpose. You avoid those acidic beverages, because it will decrease the nicotine absorption, and can be used in smokers with jaw pain or poor dentation, whereas you wouldn't want the gum at that point. You would use the lozenges. So again, there's so many different, choices for them out there. Okay, and now there's the nicotine oral inhaler. Nicotrol is the brand name. It's indicated as a smoking cessation tool, stimulates the hand-to-mouth puffing. So it kind of simulates a cigarette, basically. So you get that same, like how I said, our behaviors control. You wake up in the morning, you have your cup of coffee, and you require a cigarette. Instead of the cigarette, you do your inhaler. Okay, you get that same satisfaction, because again, it doesn't contain nicotine, right? 6 to 16 cartridges per day, use up to 6 months, and taper over last 6 to 12 weeks. Okay, so with the inhaler, you have the mouthpiece, you have a plastic cartridge. You didn't tell me you were taking my picture. I could have smiled. An open cartridge is only good for 1 day. And so once you open the cartridge, it loses its effect. So you have to really open that cartridge, and it's good for that 1 day. Continuous puffs for 20 minutes. Peak effect is achieved within 15 minutes. You clean your mouth with soap and water, your mouthpiece, not your mouth. Your mouthpiece with soap and water daily. Avoid acidic beverages, again, 15 to 20 minutes before and during the usage. So acidic beverages tend to affect nicotine absorption. Okay? Main side effects are mouth and throat irritation, so you rinse your mouth after you do your inhaler. Coughing, rhinitis, because anything that you inhale sometimes do irritate your airways. It depends, on if you have a very irritable airway, then you may tend to have more of an effect of that. Temperatures below 40 degrees significantly impact the delivery of the nicotine from the inhaler, so you have to keep it inside. You don't keep it outside in your car during the winter, because then it would affect the nicotine delivery. Okay, then we have a nasal spray, Nicotrol, most rapid delivery among the NRTs. So this is the most rapid nicotine replacement therapy because it goes directly into your lungs, right, and then it's absorbed. 1 dose equal 1 spray in each nostril, so 1 and 1. Patients should be started with 1 or 2 doses per hour. Minimum of 8 doses per day, and maximum of 40 doses a day. Available as a 10 ml spray bottle. It delivers approximately 200 applications, and you use it for 3 to 6 months. So with these sprays, it's a little bit longer duration than with the gum and the lozenges. Okay, so with the spray, main side effects, nasal irritation, decreased 94% in the first 2 days, decreases to 81% after. So as the body gets used to it, the effects get less, right? Nasal congestion, transient changes in taste and smell, because anytime you introduce anything into your nasal, it gets, it affects your taste. Any nasal spray does that. So you don't sniff it, swallow, or inhale through the nose, right? You just spray it up, and it'll just go, you try not to suck it up. Best delivered with head tilted slightly back. Avoid in excess reactive airway diseases. So if someone who has reactive airway disease, they may have more side effects from this one. So that you probably wouldn't use. Okay, so now let's go into the prescription NRTs, nicotine replacement therapies. There are 2 of them that we're going to discuss now. Wellbutrin or bupropion are the one of them. It's an antidepressant, and it's Zyban, basically. Can be used in combination with an NRT, the other NRTs that are not prescribed. So you can use this, the oral tablet, with one of the other, the gum, the lozenge, the patch, nasal spray. You can use it with those. It's beneficial for smokers with history of depression and those concerned with post-cessation weight gain. So for example, this is perfect for those patients that have psychological problems, right? Behavioral health issues. It starts at 150 milligrams per day for 3 days, then increase to 150 twice a day, right? Continue therapy for 7 to 12 weeks. And some of the side effects, dry mouth, insomnia, headache, weight loss, agitation, seizures, if doses are dose-related, depending on with psychological medications, and sometimes that can interact. Okay? So you start 1 week prior to quit date, as the drug takes about 5 to 7 days to reach the steady state blood level. So as you start this medication, you still smoke. They still smoke. until that week mark, and then they quit. Okay, do not chew, cut, or crush the tablets. Doing so will destroy the time release because it is a time release mechanism for the tablets. The doses should be at least 8 hours apart. Okay, if you're a caregiver, notice any agitation, hostility, depression, so these are some of the side effects that you would see with this. The next one is Chantix. Chantix is a very popular one out there that many of the physicians actually go to. It stimulates the dopamine pathway to a small degree, so you may not, it's that, again, that pleasurable effect, okay? It reduces the symptoms of nicotine withdrawal, and combination with NRT is not recommended due to the increased side effects or tolerability with this one. So with the other one, the Wellbutrin, you can use with the nicotine replacement. With this one, it says it's not recommended. So with this one, the dosing is pretty much tapered. So for week 1, you're starting with a lower dose, right? A 0.5 milligram day. And then as you go up day 4 to 7, you do 1 in the morning and 1 in the evening, and it's 0.5 milligrams. And then as you hit week 9 to 12, then you do 1 in the morning, 1 at night, but it's a higher dose. Okay, and this is a 12-week regimen also. So some counseling point for this Chantix: start 1 week prior to quit date, as it allows drug to build up. We talked about that. Decrease renal function, that's the downside of this, where it decreases the renal function in the patient because of the high doses of nicotine. 0.5 milligrams per day, you take with food, full glass of water, because again, water helps flush it out quicker. Main side effects is that nausea, constipation, gassiness, and such. Okay, so those are all the medications, the nicotine replacement therapy that are available on the market. Now we're going to just go into, closing it out with the decision to quit. And how do we as clinicians play a role in this with our patients, right? Should you consider quitting? What are the benefits of quitting? What are the cons? If you're not ready to quit, consider changes that you are ready for. Is there something else that's stressing you out that you need to take care of first before you start quit? All these things, and as clinicians, we are definitely involved in sharing that with our patients. Okay, success is possible. As you see, there's a lot. Back in the days, 10, 15, 20 years ago, we didn't have all these nicotine replacement therapies. It was just cold turkey. You quit and there's nothing to help you. Given the right support, the people living with mental illness quit at the same rate as those without mental illness. It all depends on if their medications are managed appropriately. All those things are very important. Social support, medications, access to resources, right? And every state now has a 1-800-QUIT in every single state now. So that is something that is very important that our patients know of. If we don't have something in our specific facilities, then we definitely owe it to them to give them that information for our specific states. Whereas, like, for example, I'm just going to use what I know. In Delaware, we have a quit line that when a patient is in the hospital, we refer them to this Delaware quit line. And what they do, they supply the patches for free to the patients while they're in the hospital. So we send a referral to this Delaware quit line. It's a state organization, a state-funded organization, where they we created a contract with our pharmacist. The pharmacy supplies the patients with a 5-day set of patches for free, because again, they're over the counter, so the patients, if they go to the pharmacy, they're going to have to pay out of pocket. give them a 5-day free, and then follow up with counseling. So they call them, they can either do face-to-face because they're counselors throughout the Delaware state, or they do a phone call counseling support type of thing, and they do that for about 6 weeks. And, they have a good success rate because, again, they're starting them off while they're in the hospital, where when you're in there, you're not smoking. You can't. So that is the perfect time and the perfect opportunity to get them to quit smoking. So access to current smoking and impact, assess current smoking and impact. This is the quit plan. You set a quit date, because you have to have a date that you're going to quit smoking. Prepare for withdrawals. So you give them all the information they need. This is how it's going to feel. This is all the symptoms you're going to be going through. Because the first time someone gets one of those side effects, they're like, oh, forget this. I don't like the way this feels. I'm going to go back, starting to smoke again. So giving them the information they need will allow the patient to have a successful quit. Decide if and what kind of medications to use. Again, there's a variety of different ones that they can choose from. Offer them the support. Use new coping strategies, and there's a lot of different things out there. Okay, what to expect. These are things, and pretty much we covered all this when I went through irritability, sleepless. These are the different nicotine withdrawal symptoms that they may have. The situations of people that trigger the urge to smoke. So say you're in you hang out with a group of people that constantly smoke, they have no intentions of quitting. Would you want to go hang out with them, or would you find some new friends? And that's the thing you have to think about, Are you willing to remove yourself from that circle of people that are smoking all the time? Because that's going to make it even more difficult for you to quit, right? Who will ask you to smoke, and how will you say no, right? Being around it, it's even harder, so remove yourself. That's what you would have to do. Relapse, weight management. When you quit smoking, a lot of people feel, I'm going to gain weight because I'm not smoking anymore, so I'm going to eat more sweets or, more fast food, junk food. Coping strategies. So substitute and distractions. Again, you may have to change that behavioral routine, your behavioral routine in order to break the habit, right? Delay, distract, drink water, deep breathe, and discuss. Those are the 5 Ds for strategies of coping when smoking cessation. Manage your stress, physical activity. Do things, break that habit up. Instead of getting up in the morning and having your cup of coffee, have a cup of juice or have a cup of water. Or don't have anything at that time. Just break it up a little bit, go for a walk first, and then come back. So breaking the habit will cause your brain to kind of change its memory of how it's normally done, and you're able to cope a little bit better, right? Control the environment around you. Move things around, right? So bouncing back from a relapse, learn from it. What can I do next time? What have I done that caused me to go back to this? Did I hang out with the same friends that I had that is constantly smoking? Review your triggers. Think about it. Every morning I get up, I take a shower, I put my coffee on. I'm gonna stop putting that coffee to make, and I'm gonna just go to the fridge and get a cup of juice. That breaks up the routine, right? And that breaks up your memory to do things differently. Positive self-talk. Celebrate your gains. Celebrate when you quit. Things like that. May need to adjust medications depending on what medications you're taking, such as those behavioral health meds. Supporting someone who quit, again, you have to be very understanding. Be patient. Praise them. Be there. Help them to relax. So as respiratory therapists, again, these are roles that we're going to be playing in the future. You guys, this is where the future is going, a lot of clinicians are going to be expected to do post-op visits. You know, it may not be therapists, it may be nurses. Nurses are already starting to do them. They've been doing them, actually, post-op visits. Be positive, be in for the long haul, right? So tips to remember. Al, this is the last slide. I see you getting a little antsy. Okay, counsel patients to quit smoking on the day they begin using the nicotine replacement, unless otherwise directed by their healthcare provider. So you have to work very closely with their physician when you're doing this. Advise that the smoking while using RRT could cause symptoms of nicotine toxicity. So sometimes if they are using the patch, and you remember sometimes as you increase your dosage or you decrease, it all depends on which one you're using. If you continue to smoke, you're going to be getting an increased dose of nicotine. So that's a possibility. If you continue to smoke and use the NRT, chances of you getting an overdose is high. Tell your patients to read the product labeling to choose, for the choice for information about proper use of medication. Just like the gum, a lot of people thought you just chew it and spit it out, but you have to park it in order for it to get absorbed into your bloodstream. So these are the quit line we spoke about. Quitplan.com, extensive resources and free NRTs. That's what I told you about. I don't know, it may vary state to state as far as what's available to patients that are looking to quit. So again, the government is all on top of this with encouraging a lot of smoking cessation programs. So that's it. Thank you. Any questions? Questions? Yes.
Earlier in the lecture, you mentioned that the smoking cessation program is going to be the way to go, or an area that's going to be strong. For those of us that work in long-term care,
it's a little bit more difficult because you may not see that. Obviously, if you work in long-term care, those patients are not, they're not smoking, right? Really?
the recreation department has a certain hours where they take in one facility.
Oh.
Facility I work in, none of them smoke.
Well, you know what? That's a perfect opportunity. It's never too late. You want to extend your life, then that would be the time to do it, you know? It's never too late. So smoking cessation programs in those areas, I think it would be optimal. Yeah. Any other questions? Good?